Hi, good morning. This is Mandy Pratt Chapman from the GW Cancer Center, and I am really pleased to introduce Dr. Priscilla Wang from Mass General, who will be talking with us this morning to support our diversity, equity, inclusion, justice work. And I am going to go off camera and let her briefly introduce herself and present her material. Thank you so much for being here this morning with us.
Thank you so much for the invitation, and it's great to meet you all. So by way of introduction, my name is Priscilla Wang. I'm a primary care physician at Massachusetts General Hospital in Boston. I'm actually in my clinic room right now, which you can probably see from my background. My background initially comes from actually the political advocacy and community engagement space. But throughout my medical training, I have since then focused my career on addressing structural health equity, or what I call structural health equity, which is basically how can you address health equity by focusing on structural determinants and really trying to get at root causes and create sustainable change. I have previously worked as a patient navigator, and then previously spent some time in DC working on consumer engagement strategy, and then more recently have led Medicaid work in our system at Mass General Brigham, and currently serve as the medical director for primary care health equity, leading some of our campaign work in one of our campaigns called United Against Racism, which is a campaign against structural racism in healthcare. And my work right now currently focuses on clinical disparities. So I'm very excited to be with you today to talk about making the business case for health equity. I am going to go ahead and try to share my screen, so bear with me as I navigate on Zoom. Slideshow. All right, now let me swap my screen. Okay, so please let me know if you are not seeing the correct screen, but I hope right now you're seeing just the PowerPoint and not the presenter mode. And so today I'm hoping to talk with you about this topic on making the business case for health equity and what this means. And so my hope for today in terms of the objectives that you'll take away. So in terms of knowledge objectives, we will speak about what is a business case, and then why a business case is relevant in the field of health equity, in the work that you all do. And then I hope that you will also leave feeling confident in terms of skills to be able to identify opportunities to align your own initiatives that you are working on with your own organization's business priorities, or at least to frame them in those terms. And then also to be able to create a basic business case for your own initiative, and be able to present this to leadership or funders or those that you're aiming to get support for your initiative from. And so I want to begin first by just saying, what is a business case? And before I dive into all that, I need to start with several caveats. One is that I am not going to talk about this from a finance expert perspective. I am not a finance expert. I'm not an accountant. I don't have an MBA, but I think many of us who are working in this field may not have those very specific skills. And so I'm going to try to talk about this from the perspective of a general practitioner in this area, and hopefully make it relevant for you regardless of what your background or prior training is. The other thing that I'll invite you to do as we go through this presentation is to listen to this through the lens of your own current work. So I'm sure all of you at the moment have either projects that you are actively working on, or those that you're hoping to be able to launch and gain support. So I would invite you to listen to this through that lens and thinking about that. And so a business case, though, just to begin right off the bat, in very simple language, is simply it is a case. It is an argument for why your project should be undertaken by someone else. You know, you don't have to make a business case to yourself, but if you need support, a business case is the way that you organize your justification to let those who are making decisions, those who are funding initiatives, believe in also the reason for your work And not only does it make the case for your work, it also does so in an analytical way. So it basically presents to those who are reviewing your business case, what is the benefit, what is the cost of your initiative, what is the risk of doing your work, but what is the risk of not doing your work? And then it makes a case for the way that you think the work should move forward in a specific way. So we don't have a huge group, which is actually great because I really like to make this interactive. So I'm going to ask the participants who, unfortunately, I can't see you. I think, and please correct me if I'm wrong, Mandy, but I believe that people should be able to, let's see, at least chat. I don't know if people can raise their hand and speak. But if anyone
Yeah,
can,
I think they can definitely chat. We could test out whether folks could speak or not. Annie, if you are able to unmute folks so that they could speak, that would probably enable that feature.
awesome. I would love, because we don't have a large group, I think this is actually great, because I would love to actually to use as a framing case for this whole presentation. If one of you feels comfortable raising your hand, and we can call on you, and if you want to share something you are currently working on, it can be very broad terms, something you're very interested in. I'd like to use that for this group to frame the rest of this discussion and kind of take us through those steps. And I see Shanti. Hope I'm pronouncing your name right. Please correct me if I'm wrong. Feel free to unmute, and would love to hear from you about something you are working on.
Morning, Dr. Wang. How are you?
Good morning. Thank you. Good. How are you?
I'm doing good. It's a pleasure to be in your presence. I thank you. I am working on an awesome project with Mandy, under Mandy, Shayla, and Miss Janice Furby. I am the community healthcare worker here at GW Cancer Center, and I am working with the patients by way of the BEAT-C study. We are taking in their experiences around the healthcare environment here at GW, and we are offering them an enhanced support by way of a community healthcare worker. So by way of doing the social determinants and providing resources, hoping that we can improve the quality of life and experience for the patients here. So that's what we are working on. It's been a wonderful experience, making an impact in the patients' lives by way of breaking down, or not breaking down, minimizing the barriers that they are facing.
That's wonderful. Thank you for sharing that. I think this will be a great case example. And sorry, did I say your name right? Is it Shanti? Yes,
Dr. Wang, you did. You did.
Okay.
Thank you.
Wonderful. So this is great. So thank you, Shanti, for sharing that. I think that's a really very relevant example. So let's use that example in mind. Let's keep this in mind as we go through the next slides, because I think there are many examples of different projects, but let's use this as one of our key examples as we move through this. So I'm going to go back again to our definition of what a business case is. And just kind of, again, I'm not a business person. I don't have an MBA. I'm not finance trained. So I like to make things very simple for myself. And so when I think about a business case in simple language, as we take some of those terms in this definition, so business, so that implies we have to think about the business or the organization that we're in. Really, how does my proposal, my hopes, our team's hopes, our team's goals, how does this relate to our businesses or our organization's priorities? Then another key word here is justification. So why? What is the rationale? Why are we hoping to do this work? And then another key word, evaluation. Really asking, what will it take for this work to happen? What will make it possible? What will it take in terms of practical needs for this work to happen? So these are three key elements of a business case. And I think this will become a little bit more clear as we go on. But if at any point that there's questions, please feel free to type them in the chat. Mandy, I'm not sure I'll be able to see the chat great from here, so I might look to you to give me a heads up if there are questions popping there, but I will try to periodically monitor that too.
Totally, I can do that.
Awesome, thank you. All right, so moving on then. So we talked about what a business case is. So here's the crux of the question. Why do we need this for our health equity initiatives? And I will say, when I first heard this business case health equity, I almost had allergic, kind of visceral reaction, because I think for a lot of us in this work, we are not in this work. All of us are not in this work to make money. We are not in this work to get some financial value. We are in this work, I believe, for reasons relating to social justice, for ethical and for moral reasons. And so I do want to start with that big caveat that we're not saying that the business case is the rationale entirely for why we are doing this work, and is certainly not a substitute for your organization, your institution, explicitly committing to health equity principles and really understanding why it is important inherently for us to address health equity. Now, that being said, with that caveat, I still think it is very important, though, for us who are in this work and for structural health equity work to move forward, for us to be able to articulate a business plan for this initiative. And so the question is why? Why is it important for us? And so I'm going to give us a couple reasons here. And this is something that I am seeing more and more now in my role, which is now at a health system level. I'm starting to understand, I've never been the person initially, making funding decisions. And now I am in a place where I'm starting to review more proposals. And I'm starting to understand more about the challenges really in this area and what decision makers and funders, how they might be making decisions. And so one key piece, and I'm sure all of you are feeling this regardless of, whether you're working in a clinic or in the administrative side, I think we all recognize our healthcare system is really going through a difficult time. Even though the COVID-19 pandemic is not the way it was, in 2020, it is certainly, our health system is in a tough place. I think I'm over here at MGH every day. I get an email, our ED is in capacity disaster. That's basically their way of saying there are no beds in the EDs and people are overflowing. And there's a lot of pressure on health systems to say, should we expand? Do we need more beds? There's a lot of technology challenges. You may be familiar with electronic medical records, but lots of different pressures for health systems to also invest in different technologies, which cost money. And then one of the biggest pieces, beyond all the technology and beds and supplies and programming, is just simply our workforce. There is a real epidemic of burnout and people leaving the workforce right now, and it's really a crisis. And so there is very real, very important pressure also on healthcare leaders to address this issue, whether it's through paying an adequate salary or providing additional supports or simply hiring more people to help spread the needs around. But in the setting of all of this, this is the environment in which we all have to make our pitch, why our health equity work is still critical, is still mission critical, so to speak, to our organization. It's not just an extra, it's not just a side hustle, but we need to be able to articulate this in terms that those who are making decisions can understand. A second important reason why we need to be able to make a business case is, I think for many of us in health equity, it's very easy for us to explain the why. And of course, that is the most important thing, to explain the rationale, the why for people. But I also feel like we who work in this space often get pigeonholed by leaders, by funders, by others as idealists, people who are pie in the sky, who really have big ideas, but are not necessarily realists. These individuals, they don't really understand what it takes, or, this is a nice idea, but it's just not possible. And I don't think we have the money. I don't think we have the capability to do this right now. And so what a business case does is it actually breaks down what you are proposing into very practical elements. It says, I can answer some of the things that you are asking. Actually, you're saying this is not possible. I can show you through these specific details how this is potentially going to be possible. And then a third reason is actually for ourselves. So I think the first and second reasons are directed towards the people that we are making a pitch to. But I actually have found that preparing a business case is actually a great way for our teams to be more effective. I think it really helps us to come to terms, to really grapple with, one of my favorite phrases is where the rubber meets the road. How do we actually translate our ideas into reality? And how can we implement this work in a way that is actually meaningful? And also, how can we use our funds equitably? I think this is a very practical question. One example that I'm coming across right now, so one of the hats I wear is our nutrition equity space. We recently got funding to give out grocery gift cards for fresh produce. But then we had to face the question, well, do we try to give to as many people as possible and then we give less money per card? Or do we want to try to make a deeper impact per person? We give more money per card, but we give it to less people. I think these are important questions that we have to be prepared to answer and think through and have a rationale. And a third element that I think is actually really important is thinking about sustainability. I think one of the risks in this area for many of us, especially I think in the community health space, when we are dealing with grants or when we have ways of funding that are not sustainable, I do think we have to be very careful when we are working with community members, community organizations, that we also think ahead to try to prepare a way to try to sustain relationships, sustain impact. Because the worst thing is, you go through all that effort to gain the trust of community members, then you don't have a way of sustaining funding, your initiative suddenly dies, and then you break the trust or lose trust among community members. And I think this is always something that we really want to try to prevent and minimize as much as possible. So I'm going to pause here and see if there are any questions, reactions, comments in the chat before I move on to some of the details of the business case itself. So let me just take a pause for a moment.
I don't see anything in the chat at the moment. If anyone wants to come off mute and has a question at this point or wants to put a question in the chat, feel free. Otherwise, we can continue. I think it's been fairly clear, but please do feel free to come off mute and ask a question.
Great. Well, if at any point you do have questions about what I just covered, feel free to put that in the chat. And so we will move on then to how we can make a business case for health equity. So there are some more technical aspects, and I think those are probably good for us to work through some examples. But I think the key piece, the key takeaway, I would say, is it's really about translating what you are doing, your beliefs, your rationale, your work into language that your audience understands. And I think this is really important because sometimes, again, like I mentioned, the allergic reaction, I had to when I heard, business case, because we're not in it for the money. For us, I think sometimes to talk about the money, the financial aspect, it feels not only foreign, it might even feel wrong or offensive. But I think that it's very important that we have to be able to speak the language that our audience represents. And so, for example, if you're presenting to a financial officer, they talk in the language of money. They talk in that's the rationale, that's their day to day. And so we have to be able to speak to them. If you are speaking to a CEO, they're thinking about the mission, the strategy, the optics for your organization. If you are talking to, say, a department leader, then they are also thinking, of course, about their maybe about funding, sustainability, workforce. So I think it's very important in business case, you have to be thinking about your audience and the perspective. They are the most important when you are presenting this. And I will say, my background, I mentioned, I started off really in the political advocacy landscape. And in advocacy, if any of you have worked in campaign advocacy or that area, you may recognize that actually what we're told is that one story is actually the most important. And actually, if you're presenting to a politician, it is very clear actually stories can have huge impact to drive change. And stories are still important. They can be very important in the framing. They can be really important, in bringing the human aspect to our business case. But what's important to remember is when we're making a business case, that it's not enough to have stories and anecdotes. Data in this case is king. Data is critical. You will for certain ask if you are presented this. Well, where's the data? What are where are you getting the information? Where are the numbers? And you'll be asked to present something that's concrete. And that, I think, is very much because of the language that your audience is speaking. So this is just one key principle to keep in mind. So going through 3 key principles then about how to make a business case. And this is, I think, very high level principles, but relevant for regardless of what scenario you are in. So the first thing is, speaking of the translation into the language, make it clear how your initiative directly relates to your organization's mission and their stated key priorities. I have a mentor who used to work as a chief quality officer over at Boston Medical Center, which is one of our state's key and largest safety net hospitals. And they have really operate on a shoestring budget, but they have done amazing things. I think that my own organization currently, Mass General Brigham, could learn a lot from them. And what my mentor said is his very simple model when he was deciding to fund things, it was along 3 dimensions. So one is, will it benefit our patients and community members? Will it improve health? Will it improve quality of care? Will it improve health equity? A second practical dimension is, well, what's the financial impact? Will it break even, or can it even make a profit? Was there a financial return on investment? And the third was, is it sustainable? And what he would say is he would actually look to try to achieve at least 2 out of the 3. So for example, you might have an initiative that improves health. Let's say, we're screening for colon cancer. It will improve health. It will not necessarily break even financially and make a profit. Screening is not something that is often profitable for a health system. But is it sustainable? Yes, because health insurers will at least pay for the colonoscopies. This is something that is kind of baked into routine care, is something that we can do. And so this initiative improves health, it's sustainable. So something to help improve colon cancer screening could be something that is worthwhile pursuing. Another example might be one in our organization. So we have a virtual sports medicine option. In this case, well, I would hope it improves health. It's not necessarily clear to me whether virtual is better than in person, but it definitely will make a profit because there are a lot of people with different muscular injuries, skeletal injuries, and it would be sustainable because there is a workforce, a whole team that can do it. So, well, maybe we need to measure the health impact, but at the moment, it will make a profit. There is a team to do it, so we can move forward with that. And so these are, I think, just practical considerations, dimensions along which to kind of consider and evaluate your work. But I would like, let's take a moment though to think about our initiatives. I have an example that I'm working on right now, but I want to go back to Shanti's example. And I'm going to ask Shanti, but also the others who are on here. Again, we're not a giant group, so this is great. I think we can, flex our muscles and try to practice some of these skills. So maybe Shanti, let me have you, if you don't mind, kick us off with maybe for the initiative that you're considering. How could you frame your initiative in terms of the organization's priorities? And then I'll ask others who are not working on your initiative to actually chime in because they may have other dimensions they want to consider.
Dr. Wang, can you ask me that one more time? I apologize. I had got a call in the midst of you asking.
Oh, no worries.
I apologize.
No worries at all. I was saying, so if you don't mind, if we can take your example and say, we know, I think for all of us, we know the equity rationale for why your initiative would be impactful, but can you think of how could we frame your work in terms of how it would align with your organization's mission or priorities? If we think about the language through which your organization talks about what's important to GW or what's important to your team, your broader organization, can you think of ways that you could frame your initiative in their language?
Dr. Wang, I'm gonna be honest. I'm a little jittery right now about that question. Um,
That's totally fine. Let's see if there are others who can chime. This is exactly why we want to work through this. This is
okay.
where, that this is, I think for us, this is not natural for us to try to translate from the language of equity or DEI into other people's language. So maybe I'll ask if there's anyone else who feels comfortable taking a stab at this. Or even someone who just, oh, go ahead. I see Shayla. Thank you, Shayla.
So one of the things I would say is the work that Shanti and I, that we work on is addressing barriers and providing support and resources to community members. Translates into loss to follow-up. So if we're able to support patients in their care and get them to their appointments, we're able to keep them actively engaged in their health, which ultimately helps the hospital system, but also the patient as well.
I love that. So that's great. So we know we have been thinking about, the benefit for our patients, but as you said, there's also a benefit for our practices. If individuals come in, they don't miss their appointments, they're effectively engaging in care, that will make it helpful for our clinics, for our systems that have the appointments, and also for our hospital to be able to fill those appointment spots. And also broadly, I'd say, and be able to, maybe if one of their goals is to improve access for people, making the best use of appointment slots can actually improve access for a lot of people. So thank you. I love that angle. Are there others who would like to chime in and think about other ways that we could align this, or even someone who just wants to maybe name one of the priorities for the organization, or even take a moment to Google it? Because actually, I think for many of us, we may not be aware of what the key priorities listed for our organization are, because we are working, in our individual areas.
Well, I would say, at GW, one of our key priorities is moving toward NCI designation. And I think a strategic imperative for that is to show progress in the area of health equity so that we're actually meaningfully making a difference to our catchment area. So in terms of the case that Shanti provided, if we can demonstrate an impact with our evaluation data that providing enhanced support does in fact address cancer disparities and bridge some of those differences, then I would say that would be one of the pillars that you mentioned. I think another opportunity is the new physician payment proposed schedule from CMS does include social needs screening and potentially CHW support. And so depending on whether that's finalized, that could be something that would institutionally support sustainability in terms of probably not making a profit, but just trying to cover some of the costs that are grant funded. So
thank you. That's really helpful. And so it seems like those, now we have external dimensions too. So one is meeting regulatory requirements. Like actually that's a priority for our organization. We want to make sure our organizations are in alignment with requirements, with regulations, even be able to obtain certifications. And then also thinking about reimbursement. So in order to get the money, the reimbursement, to be able to align with those elements. And I see Talisha, and I apologize again please correct me if I'm not saying your name correctly. You have your hand up.
We did, so thank you. That's the correct pronunciation. I just went to our mission statement and on our website, and we too are doing the social needs screening at Howard, but it fits well into our mission, which, as stated on the website, our work embraces the diversity of the African diaspora, and seeks to achieve health equity and health justice for all. And it also relates to our core values of excellence, equity, and engagement. So I think it matches our mission precisely, our efforts through the social needs screening.
That's wonderful. And I think it's so refreshing, and you don't have to do the kind of almost gymnastics when you have an organization that explicitly names and promotes health equity in the mission statement and values. So I think that's extremely powerful, and that's so wonderful that you can align your work directly with that. And I think the examples that others were just discussing too, also in cases where your organization may not explicitly name those priorities, that is something that I think for certain is going to be, will be helpful to think about these different framings. And so I'm going to use another example now for us. This is on connecting, this is work that I'm trying to do. So SNAP and WIC are public benefits that are federally funded to help individuals who have low incomes, individuals on Medicaid, access healthy, nutritious foods. In our state, in our organization, we think probably about 50% of people who are eligible are not receiving those benefits. So one of the goals of our team is to try to think about how can we find these individuals and connect them to those benefits. So I'll give you an example of how our team thought about framing this in terms of our organization's mission statement. So one of our key missions is to improve health. So what we want to say is, yes, addressing food insecurity addresses health equity. It also improves health just as just because nutritious food is important for achieving wellness and health. So that's one piece. Then we thought about the financial side. So we said, you know what, we have a Medicaid, we have a group of Medicaid patients that we are responsible for. This is called Accountable Care Organization. Our organization, we have a health plan that actually insures our Medicaid members, and we own the health plan. And so it's in our organization's best interest if all of our health plan members are as healthy as they can be. Healthy people also will use less healthcare costs. So this is one way we can kind of frame in the language of those who work in finance, well, this is why this makes an impact for you. And then going to what Mandy was saying, this is important. This is a way we screen for SNAP and WIC. Actually, in one of our Medicaid contracts, this is a requirement for us to screen. So we said, well, we are required to do this. So it makes sense that you will fund us to do it well. And we want to do it well so we can meet these different areas. So I hope this little exercise of kind of working through this, trying to reframe your priorities and your work, I hope this helps to illustrate how you can do this in different contexts. I think it's an important skill to be able to have, and one that comes with practice and kind of that flexing that muscle. The second piece, and this is where I think for me, this is even more foreign, is come prepared to present a simple pro forma. So pro forma just literally means, as a matter of form, something that you kind of have to do. And I'm using this term very loosely. If any of you are business people, you may be, I may be giving you heartburn because I'll speak about this very loosely. But I think this is, it's a little bit more practical to speak about this in a very general sense. And so a pro forma, in simple language, it's basically a document that says, if we make some assumptions, because none of us has a crystal ball to know exactly what will happen in the next year or the next 3 years, if we were to make certain assumptions, what would the health impact of this project be? And so these are the questions that, I showed on the screen previously about what a business case might consider. But these are some very practical questions to consider. And so I'm going to walk us through this pro forma. And I think actually my example here, so this may be relevant, Shanti, to some of the work that you're doing, because our work, we are also looking at community health workers. But I want us to all keep Shanti's example in mind, see if we can think about what some of the pro forma elements that we might need if you were going to present this, write this up in the business case. So in a very simple language, I think a pro forma is basically a way where we can say, what would it take? And it kind of walks us through different scenarios. And I think many of us, when we see numbers, our eyes kind of glaze over. This might seem very complex, but let me walk you through what's happening here. So the example in my organization that I was working on is we have an initiative in our United Against Racism work to close the gap, to try to concretely close the gap in blood pressure control between Black and white patients and Hispanic and non-Hispanic patients. And the way that we think that we want to do this, that we should do this, is through community health workers. But as we surveyed the landscape, we realized that we did not think we had enough community health workers. And so we wanted to make a business case for why we need more community health workers, and not just to say we need more community health workers, but try to use data to explain why we need more and exactly how many more we think we might need using some basic assumptions. So, and please stop me at any time if any of this is confusing or you want me to review a point we just made. So the first thing we said was, okay, we have a mission, we have a goal. What is the need currently? So we looked at some of our different hospital sites. When I say hospital, these are really, primary care sites. We looked at our sites and we said, how many primary care patients do we have at each of these areas? How many Black patients with hypertension do we have? Just to get a ballpark. And we found some hospitals have a lot. You can see hospital A has a lot. And hospital B has maybe the second most, and then going down the line. Then we said, okay, among those patients that we know have high blood pressure, how many are actually not at goal? And so then we looked, and those are a smaller number. So this was helpful to see as well. This kind of gives you, but also decision makers, a ballpark of how big the problem was. And so we said, okay, at hospital A, we have about 2,000 patients that are not at goal. And then, we had a goal that was a 5% improvement in blood pressure control, very ambitious. And as we did this exercise, we realized how ambitious that goal was. So we said, okay, if we want to improve by 5% for each of, this doesn't add up perfectly because we did 5% for Black patients, 5% for Hispanic. So the 261 is not exactly 5% of the 2099 here. There's a little bit of funny math, but the basic idea was, okay, how many patients do we have to impact to get to our goal for this year? And how many patients, okay, that's one thing. But we also know how many patients impacted is not the same as how many patients outreach to. Because for those of you who work in community health work, you know that you're going to outreach to some patients. They may not want to participate in your intervention. And so we said that how many of these people are we going to need to touch? So, and we actually wrote out those assumptions in our business case. So here are some examples of those assumptions. We said, okay, in our system, we're assuming one community health worker carries 30 patients. We want about half of that time just be spent on blood pressure work. We also think we're not 100% sure of this number, but we think roughly maybe 1 out of every 3 patients we reach out to for blood pressure work will successfully engage and will be able to get their blood pressure down. So that's how we got this number, this based on estimates. How many patients do we think will require this intervention? Then we said, okay, well, how many community health workers do we have right now? And so you can see the different FTEs that we had across the different sites. Then we said, and there's a little bit of difference about how much at different sites a community health worker will spend time on blood pressure. So we said, okay, how much time is actually available for blood pressure work, et cetera, et cetera. There's some things that are specific to my organizations here. But then the gist of this is we said, okay, based on all of those numbers, here are the number of community health workers that we think we're going to need. And you can actually see we are missing a good, almost 10 community health workers to be able to get us to our goal. And then finally, we said, okay, if we think that we need, and then we rounded up these numbers, okay, we need about 5 community health workers at hospital A. And then we also need to address social determinants of health. We need these community resource specialists. If we are going to use our community health workers to do both blood pressure and social determinants work, let's say we want to achieve everything. We want to achieve both the hypertension work, and we want to be able to screen for and address every social determinant of health need that we pick up. Here are the additional resource specialists that we think we need. But then we said, okay, well, what if we said as an organization, we are going to commit to addressing 50%? Here's how many we need. So the math here is not, may not make the most sense if you're not really digging into the weeds, But I hope the concepts of the thought process that bring us through these numbers make sense. But let me pause here. This is a lot of numbers. I'm going to flash back to this screen because I think this gives us some of the assumptions, some of the examples. And I really want to pause here to see if there are questions, if we can go through anything here.
Any questions from anyone? I think, what you're illustrating is kind of explains why we build evaluation into our programs so that we can estimate how much a particular person can do for a particular project, and what that why kind of the scope of that particular role is important. And so I really appreciate this in terms of kind of explaining the why behind the documentation piece of what we do. But does anyone have any questions at this point? This is kind of different from how folks are typically thinking in this space. So
Good morning, Mandy.
good morning.
I want to thank Dr. Wang. I tried to make my notes, so I thank you for helping me gain a illustration, have a physical illustration so I can translate my work. I think sometimes I get jumbled up in trying to translate it. So thank you. Thank you for the word pro forma. I wrote that down as well because you learn something every day. I'm so grateful for what you have illustrated. You said, will it improve health? My role, and which Mandy and them, the program that Mandy and them have put together thus far, yes, it is improving health. Is it sustainable? Yes, I believe. I'm so grateful that you gave me an understanding to the data part of it all. So now I have a clear illustration of what the data is needed to really make an impact and getting this position, having it be as effective as it is with the community. I thank you for saying that the stories are important, and it brings a human aspect, right? Because sometimes we write things on paper, but it's different when you try to implement them on different people of different ages, of different races. So I'm thankful for that. And we have been effectively engaging with patients, and to Shayla's point, getting them screened, getting them in appointments. They feel encouraged, they feel inspired. I try to have a little humoristic twist on it because I know that endorphins is good for the body. I like to make them smile and just let them know that they are heard and supported. And we've done a phenomenal job in pulling resources. We don't have so many built in as of yet, but we do have a strong resource portfolio that when a patient comes in, we address the barriers right then and there. As soon as they say it's a food access, transportation, we're filling out the applications right then and there. We're not going to wait. We're going to try to de-stress the situation so the patient can come in and feel comfortable in coming in. And a lot of patients, they get in their head about the disease, about reoccurrence, if they have support or not. So this enhanced support makes them feel at ease when coming in. So I thank you for this illustration and helping me get a better understanding to our work that we're performing, and feeling confident in translating my work, right? So thank you so much.
That's my pleasure. And thank you for that feedback. And also, I think the concrete examples you shared, with this pro forma here, we are focusing, for example, on blood pressure, but you just outlined in community health work, there is so much different dimensions that you do impact and measure. And so for you, Shanti, or others who may be doing it, your pro forma may look different. You may not be saying, number of people requiring intervention for blood pressure. It may be, here are the number of, transportation, the number of transportation rides that were arranged, if your goal is to impact getting to appointments, or here are the number of social determinant resources that were actually provided per patient. And if our goal is to address, 50% of those, here are the number of community health workers we think we will need, for the next 2 or 3 years. So thank you. You added some very practical illustrations to that dimension. Now I want to add another. Now we're going to go another layer. Again, I don't deal in salaries, but some of you may, and these are also very practical. This is way more in depth than you need, but for any of you, just in case some of you are dealing with hiring, with dealing with salaries, this is another example of, one of the things our organization is doing, for example, is building what we call bridge clinics. These are walk-in clinics for individuals with substance use disorder. They don't need an appointment. They can just walk in. Those clinics are for health equity, but they need staff. And this is just the point I want to make on this slide is not for you to, be able to do fancy math or that. It's just to recognize, what, when we implement these things, we need to think about all the expenses. So not just, the payment of the salaries, but here I think the important is it's not just the doctors, there's medical assistants, there's front desk, office staff. Those are expenses we need to think about. There may be other things we need to think about too for community health workers or others, benefits that we pay, the physical location, and then also how can we ramp up visits to make something profitable, especially if any of you are doing billing for visits or anything like that. That's another way to show, financially we can actually make a return here. And that's kind of what this example is showing. And this, if you Google Medical Group Management Association, they have a whole article on pro forma that I borrowed this from. It's maybe more in depth than any of us need here, but just in case for any of you, that's what you're looking for. And then the third and the final point I want to make just on how do you make this a business case argument, I really want us to think about also the financial side. I think there are a couple ways to think about the financial side. One is a negative side. I actually really like this. This is a great article. If any of you look this up, Deloitte, U.S. healthcare can't afford health inequities. There is this fascinating report that Deloitte, this consulting firm, put together and said, we actually, there's a huge moral case, but there's actually a huge economic case too. If inequities in the US health system cost us $320 billion today, and if we don't do anything, in a little bit more than a decade, it could increase to more than 1 trillion, which is staggering. So there's a broad financial case. And here's how they actually calculate some of this. They said, what? Let's look at the disparities. And then let's look at the cost of those disparities. And then let's look at the unnecessary spending, because no disparity is necessary. Any disparity, there's no reason, that we should have inequities or disparities. And so those disparities are leading to unnecessary health costs. And so there's some really fascinating work here. And I think that this is an argument that's important to make to our leaders, that we can't afford not to address health equity because of the way that they also contribute to costs and spending. I think the example that Shayla gave before too of missed appointments, here's another practical example. But on the positive side, there is also, and Mandy alluded to this, so now more and more our health systems are moving away from what we call fee for service. That's basically saying we're paying you, health insurance will pay us based on the number of surgeries we do, the number of visits we have. And instead they're saying we will pay you a big amount of money to take care of all the patients that we share together. But for us to pay you that big amount of money, you have to meet certain requirements. So this is actually a very positive way of how payers, health insurers, if any of you are considering work in that area, can help organizations succeed. But what can be helpful is for you to learn about, maybe talk to one of your finance people, your population health people, your value-based care people, find out if you have any contracts that actually have these requirements, whether it is a requirement to screen for social determinants, a requirement to have community health workers, or even if there's certain quality measures that they're trying to make, like percent of visits that people actually attend, or percent of people with blood pressure that percent of people with a high blood pressure that we need to address. And you know what, Talisha, I'm just seeing what entities within your medical system were needed to create those reports. That's a great question. So I think it's going back to the pro forma reports. So that and Talisha, correct me if I'm wrong, if you're not referring to the pro forma, but so for that pro forma, we actually did that, and I'm going to go back, actually, let me go back some slides to my own, the one here. So for this, we actually did this in our own team. So we're not finance people, but what we said was we had to work with the staff, the people who manage staff, and then we needed to understand, basically work with staff, people who could tell us how many community health workers are at the different sites. We need to work with some of our population health people to get this data, which is on the demographics and blood pressure. So we need to work with some different teams. We actually did not need to work with finance necessarily. You may need to work with HR if you need to get a ballpark salary for how much, the average community health worker salary. But actually, we were able to build these reports with just the basic data from our population health team, and also from some of our organizational leaders who manage, or managers who manage the CHWs. So that is a great question. But for a report like this, you'll probably need HR. You would need to ask HR about benefits, about salary, and all of that. So that's a really great question. All right, let me flash back to the value-based care piece. So on that, I will say that it behooves you. So speaking of entities or people that you need to make partnerships with, it is probably if you're making a business case, this is a good team. Anyone who deals with those contracts, you may want to get a meeting with them and try to understand if there are any metrics, requirements that actually your team could directly impact. Speaking of what we were saying before of the translation piece. So let's put it all together then. And just to summarize, so we said a business case provides the justification for decision makers and funders for why. It's important that we as health equity leaders, as people in this space, can make a business case because of multiple competing priorities, and also to show we are not just idealists, we can do the work. And I think that's critical for structural health equity. And finally, the key part of a business case is translation. It's not just what I think is important, what my team thinks is important. It's to translate this into the language of what our system thinks is important, and to show what it will take, and the costs of doing the work, but also not doing the work. However, I do want to end by just saying, circling back to that point, there is no substitute, though. The business case is important. This is a practical reality of what we need to get the work done, but it is not a substitute for the moral reason. And one piece I'll share, this is a study from Harvard Business Review that I actually found encouraging. They did a survey of employers and employees who are trying to get companies to act on social issues. And they found that the business case alone was not the deciding factor. The moral argument was the strongest piece. But what they found is the combination, the moral argument plus having the business case, was the most effective. But I think it's important. It's the moral piece. It's the ethical piece. It's the justice piece that actually can have the most impact. And don't feel obligated if you are trying to get a fund, make a decision. You don't need an incredibly detailed business case or pro forma. Sometimes just coming in with your vision, the mission, the rationale is it may be sufficient. But just the pro forma is a good exercise, though, I think, in the background, in a very basic way, to make sure you're prepared. And I wanted to end with the quote: "The arc of the moral universe is long, but it bends towards justice." And so I think the work that you all are doing is, how can we, in very practical ways, how do we bend the arc? And also, in the words of Dr. Jim O'Connell, so he wrote that he was the feature of this book by Tracy Kidder called Rough Sleepers. He's done amazing work to really advance humane and equitable care for some of our homeless and unhoused individuals. He said when he was criticized at his work, people said, well, the money that you're using on your work, it could be used for, it could be used to do more, even better things, build housing. But his argument is, this is what we do while we're waiting for the world to change. So I think in the business case, the work that we are doing here, it is necessary, and it would be ideal if we worked in a health system that was equitable, that recognized equity as the driving force for everything that we do. But while we are working for that to happen, this work that you each are doing, the way that you can frame this in a business case, this is what we do while we're waiting for our systems to change. So with that, I will close. I think we have 5 minutes for any remaining questions.